also work with the CHISON Sonomax, and I was very curious how it works, and I show you. I also work with ultrasound in emergency and interventions, so I need some light and mobile systems. And yeah, since a few months I also work with the Sonomax and Sono Air for my interventions when I puncture vessels. And I really like those light systems. And this is like on a ward route there. I need light systems to take them with me. Yeah, this is an example of a vessel with my catheter. I really need those clear images to see my catheter to work safely. And I've worked since 20 years in ultrasound, and I almost never had those clear images for my interventions, so I really can tell you that I love to work with those devices. Yes, and now I have a few clinical cases. The first was a patient with dyspnea and chest pain, and this is what I found. Those are images with the Sonomax, and what I found was a lot of fluid around the heart, and that was the cause for the dyspnea and the pain, because the heart couldn't work as good. It's called pericardial effusion. And I show you those pictures because I need a lot of depth, like 15, 20 centimeters, to see all the heart and all the effusion all to the back and onto the spine of the patient. And I have an excellent and consistent quality in the depths with those systems, and that's the reason I want to show it. This is the same patient, and here I see the fluid around the heart and the lung. This is the spine, and it's not also not only the B mode, it's also the color mode, which works perfectly in the depths. So those images I think are really impressive. This is the lung of the patient, like the whole half thorax, and here I need the depths and I can scan it easily. The next case was a pretty impressive case. It was a young male with a syncope or unconsciousness during soccer training. And maybe, as you know, if a patient experiences a syncope during sport, we know they have a very high risk for sudden cardiac death in sports, and they need a very high quality cardiac exam. And this is what I did and what I see. Here you see the left ventricle, and maybe you saw some normal pictures before. Here I saw the very thick muscle in the heart. And in those cases, I need to measure very correctly to have the right diagnosis and right treatment. And with the CHISON Sonomax, I have a very good and easy workflow. I can detect the walls easily. Here I measured 17 millimeters wall. Normal is about 10 millimeters. So this was a high-risk patient, and he got an internal defibrillator to prevent sudden cardiac death. For the same, it's called a hypertrophic cardiomyopathy, which is the most frequent cause for sudden death in sports, especially in the young patients. This is the same patient. On the left side, you see a healthy individual, and you can tell that this muscle is normal, it's small, and he has like huge muscles. Can you maybe we can see the pictures of thank you. Yeah, you can see the thick walls in the Sonomax very clearly, which is very important to take the diagnosis. What I also need to do in those patients is to confirm speckle tracking or strain. It gives me a lot of information about the stiffness and the damage of this muscle. And I don't need my high-end machines. I can do it with the Sonomax. And as you can see, it works perfectly. And I could do the whole examination with the CHISON Sonomax. Yeah, next small case is a patient with sudden strong cardiac pain. In cardiology, we have a lot of emergency. So this was a patient in my hospital with sudden and very strong pain, and there I need to be very fast to know the time of muscle. Maybe it's a heart attack and I need to go there very fast, but I don't only need to go fast, I need a high quality to see what's happening in this heart. And therefore I use the CHISON Sonomax now because I have both. I have a light and mobile machine and I have a very good quality. And here you see the scan. This is the left ventricular muscle, and usually all the parts are turning inside. And here you see like this part is not moving. Also on the right side, it's not working. Okay, but here on those sides you see the big scar. So this was heart attack, and I was very glad to have the CHISON Sonomax have the fast exam. Yeah, this is what it looks like. It's a clotted artery, and we have a big scar over here. It's the same that we saw here in my image, and therefore I of course need a very good quality to see. Yeah, like I had the Sonomax, and I like that it's light and mobile, and especially I like the very long-lasting battery mode because I don't have time and brain for the search for the electricity, so I need the battery mode. Yeah, the next case was a patient with very high blood pressure, and in high blood pressure we have a look for the stenosis of the renal artery. So I was in need for a sonography of the renal artery, which is one of the most difficult exams we can do because it's in great depth and we need to see the small renal artery. And here I show you a picture with the CHISON Sonomax. Here the B mode is very clear, and I can show you this is the aorta and this is the renal artery. And here I have a look for stenosis, and I can see very clearly that there's no stenosis there because it's all like all fluid. There are no artifacts, there are nothing else I can see even in the B mode scan. And of course also I can perform the color Doppler where I see the color, so the blood streaming freely, so I could say there's no stenosis. Yeah, the next case is a 50-year-old male. He came with dyspnea at nighttime, so we suspected some cardiac pathology, and I did this scan. So this looks perfect. It's like a normal heart. It's the left ventricle, right ventricle, and the muscle is moving freely, and I can easily see it in the scan. It's very good quality. But it's not just a good quality. I have a lot of great tools for optimization at the CHISON Sonomax, so I can use the zoom, I can change the frequency, I can change the color, the chroma map. I really like the chroma map because the contrast is very good in those cases. So here was everything normal. Then of course I need to do the color exam to see the blood flow and maybe some leaky or insufficiency in the heart valves. And yes, as you can see, I have very smooth color. They stay in chamber. That's what I want when I do the scans. In every cardiac exam, we also do the Doppler, like pulse-based Doppler for all the flows. And yes, as you can see, I have excellent contrast. I have a very clean spectrum, and I can do the measurements very exact. I also like the workflow for all those exams. It's very easy to find. This is called M mode. There I have a look for the function of the right ventricle. This is the right ventricle, and I need to know is this lateral wall moving freely or not. I use the M mode, and as you can see, I have an excellent contrast to measure these waves, or the height of these waves. Yes, and as you can see, I did it perfectly in this patient. And it was a normal right ventricular function. Yes, and in my hospital, of course, I have the opportunity to do head-to-head ultrasound testing. And I did a pretty unfair comparison in this patient because I compared this patient to my high-end machine. It's a 100K machine, but I was very impressed. It's the same patient. I took almost the same pictures. This is the CHISON DM. This is my 100K machine, and I think there's no difference in the quality of the B mode and the color mode. And I was very impressed, so I thought I can show it even if it's an unfair comparison. So in the patient, I had a look for valve defects, and I didn't see them in the mitral valve, but then I continued to the aortic valve. It's again the sonomax and the comparison. Again, there's no real difference, but now I see the blue flow out of the aortic valve, and there's a red flow back into the ventricle. And that means it's a leaky aortic valve, so this is an insufficiency which can cause dyspnea, especially in low heart rate. So the patient had a low heart rate and then had dyspnea. And as you can see, for me it's important that I have a smooth color and that this color stays in the chamber, so it's like a real blood flow, and I can see in those pictures perfectly. Here I freeze it to see the insufficiency, and it was easy in both cases. So the diagnosis was the aortic insufficiency. Next, I need to perform a tissue Doppler to see the stiffness of the heart or the left and right ventricle, again in the comparison, and I must say I'm very impressed with the tissue Doppler imaging in the DM. It's very smooth and very great pictures, and even if I do the Doppler of the pulse wave, there I measured the velocity of the heart, and I can do it easily with both machines. It's very clear, I can measure very exactly, and I'm very glad to have it with this machine. In those patients, it's always important to do a stress echocardiography. I don't have any pictures here, but I can do it with the CHISON DM. I don't need my high-end machine. What I also like is the virtual apex. Sometimes, as you know, with the sacral probe, it's very hard to see the apex of the heart. And with the virtual apex, I can see better. It's broken here, so I can see all of the walls, and I can scan for plaque, because plaque are often the cause for the strokes. So in both pictures I can see the wall, but I work with this machine a lot and I like it a lot. So in this case I didn't detect any plaque, and I needed further search for the cause of that. Here again is a zoom image of the carotid artery. This is the CHISON DM, and as you can see, there it's a perfect picture. And the wall is still very smooth. There are no thrombosis or no plaques detected. The next step is always the color mode. So I put the color mode on, and it's important that the color stays in the vessel. And as you can see, I can do it with both machines. And you can see the very fine contrast. This is the spine, muscle, and the vessel. So I have a perfect image. Yeah, and also the Doppler spectrum is important. Here you can see the spectrum. It's nice and clear thing.